everyone, it's Tammy Tiller-Hewitt with another Friday from the Field. This is Kim Boo from Lumeris.
Hi everyone.
Hey, so we're at a conference, we're doing a Make It Matter conference, and we have people from around the country, but we were so privileged to have a member of the Lumeris organization here. And Lumeris is a population health company in St. Louis. But it's interesting how much they do that crosses over with liaisons. So I wanted Kim to come on today and talk to us about some of these scary population health terms that are crossing over into our world, because we are working together, our organizations are working together to bring population health and physician liaison teams together to truly make the dream team. But we had an aha moment here at the conference when so many people were confused about some of these terms that we're throwing out. So I'm gonna have Kim, I'm gonna hand the mic over to Kim and just have her talk to you about the differences between the terms population health, at risk, value-based contracting. What does all this mean to not only the industry, how it relates to physician liaisons, and how we're working with physicians and their practices?
Sure, thank you, Tammy.
Sure.
I definitely think population health is going to grow in the coming years. I think managing a population where we're looking at the quality outcomes is just going to grow throughout the industry.
Right.
I think value-based care contracts are going to see more of that with our different payers, because the goal is to keep a patient population healthy versus chronically always going back and forth to the healthcare systems, putting a lot more strain into the market that we're in. So I believe population health as well as value-based care is just continue to grow. You know, the goal is to really, how do we manage a population in a way that are keeping them healthy and out of the healthcare systems?
So let's talk about, so we have at risk, we have value-based, we have population health. What's the difference between those three terms?
I think they're all really related to each other. I think population health and value-based care, they kind of intertwine. I think value-based care contracts are really looking at how do we manage the quality care of a population.
Okay, so is that a contract between the payer and the physician, or the payer and the organization?
It's the payers with the organization, but it trickles down to the providers as they're the ones responsible to meet those quality metrics and the quality our contract measures.
So it could be the physicians in a PHO, or it could be just limited to their physician enterprise, right? And almost every organization has an employed enterprise.
It does vary by the contracts and by kind of how the clinical integrated networks are set up as well.
Yeah, so you guys know most liaisons now are working with the CINs of their organization. They're very much a part of it. Well, your population health is falling under that whole initiative as well.
Definitely working with clinical integrated networks, as that's where the contracts are usually at that level. And so the value-based contracts really look at quality measures and other aspects. And so yes, I think you're going to see a lot more clinical integrated network working together to manage some of these value-based contracts.
Okay, so last I want to talk about, so we know the difference, but we know what a physician liaison is, right? Power to the physician liaisons out there. A lot of people don't know what a population health manager is. So as I talked earlier, we're combining these in some markets to make the dream team. But how would you define what is a population health manager?
I think a population health manager is an individual who helps the practice with their journey from volume to value. They're helping the physicians understand this new way of thinking about how to manage the patient population. They're bringing in data, they're bringing in information, they're working with our analytics teams to really kind of understand how do we help and really manage a bigger population of people versus an individual.
So these are literally individuals who are assigned to the practices that are in kind of behind the curtain, we say, working with the physician and their staff to understand how are patients able to get in your practice? Do you have availability? How are you coding and documenting? How are you, your enhanced encounters? How are you spending more time with the Medicare population?
I think they're helping with practices with understanding workflows.
Workflows, oh, that's a good one.
How to help them, better use workflows to be able to manage the population better. Looking at how do we take the technology to even use that information to say, okay, these are the things that I should do for this patient population. Population health draws a variety of different things.
Right.
You talked about documented coding. We talk about care delivery. All those all encompass a really good population health management system.
So how I feel like we can, well, I'm gonna take that back for a second, how I feel like we can work together from the liaison role and the pop health manager role is we know that part of, or most of what we do as liaisons is try to grow market share or try to sustain the market share that we have. So we try to manage leakage, we call it, whether it's network optimization, care retention, whatever we're trying to call it. That's exactly what's happening across the country in organizations. But under a value-based care, we're gonna have to help the practices, help the physicians transition and understand.
Think of things differently.
Yeah, think differently and also do things differently, but the why behind it. Because everybody's gonna, step up to the plate if they buy into the why, but you can't buy something if you don't know what it exists, right? Yeah.
So I agree. I think the population health managers as well as physician liaisons should definitely be a partnership to help with the journey from volume to value, but really working together to build those relationships with the providers, because it is a change.
Right.
What we're doing is changing the landscape of how we think about healthcare. And I believe that physician liaisons and population health managers can really merge together to really help guide physicians in that journey.
Yeah. So if you don't know about the population health initiatives going on at your organization, speak up, raise your hand and say, I'd like to understand it more, and even more, you'd like to be a part of it, because that is where the future is going. And liaisons, you have a huge role in this journey. So don't sit back and wait for someone to call you. You raise your hand, or else the train's gonna leave the station potentially without you. All right, so thank you so much. Thanks, Kim, so much. It's great to see you this week. All right, everybody, we'll see you next Friday on the field. Bye-bye.